Hello. Today I'm going to go for an asthma care pathway that is using process mapping and automation to deliver more streamlined care and to drive efficiencies. This has been built in collaboration with IBM and is just one area of the NHS that Responsiv are currently working in. As well as focusing on clinical care pathways, we are also looking to understand and optimise processes across all functions of our health service, everything from HR to finance to operations. We start here by looking at the process map for the asthma care pathway. This shows all the stages and participants to this care pathway. We start with Mark, who is the booking agent. A patient has presented and he is logging into the system. Once in, we can see the first step is to book this patient in. The patient here is Jill Wright, and she is searched for in the patient record system. Her details are brought up. And the patient is booked in. Notes are entered as she's booked in, just to give a bit of detail around breathing issues. That's then confirmed. And this is then passed to Caroline, who is the triage nurse. Caroline then logs into the system. And she can see that there's a new task to perform an initial triage on Jill. She can also see the process and which step we're at. You can see who has completed the previous tasks, when they were completed, and understand the steps that she needs to take next to deliver care to this patient. Again, here Caroline can see every step that has been taken by Mark to book the patient in, understand the next step that she needs to take, and then can begin performing this on Jill. She also receives a push notification to her mobile to say that Jill is overdue for this triage. This will obviously help her to prioritise. She then claims this task, is able to see the full patient record from the patient record system, see the previous comments which had come from the booking in about trouble breathing, and is then able to add an X-ray as she takes this on Jill. And then this image will be available for all of the clinical staff in this process to view as they assess Jill's case. From observations, Caroline believes that Jill has got asthma, so she confirms this, adds a comment around the symptoms that she's seeing around breathing, and then she will pass this on to the next stage of the process. This is then passed on to Vicky, who is the triage manager. And as you can see here, here's the steps she needs to go through for the secondary tests. She will log in and look at the previous information that's been entered, claiming the task. Again, just checking where the comments have come from the other clinicians, having a look at the X-ray that had been taken, and then beginning to complete the tests that are required for asthma. So things like respiratory rate, the breathing condition, heart rate, etc. And behind these, there is a set of rules which will run a advisor, which will suggest how severe the symptoms are. In this case, they're severe. However, she has forgot to include cyanosis, so she then does that, and it appears that they're actually life-threatening. So it's obviously quite an important case. She then adds a comment to this, and this will be passed on to the asthma nurse who will pick this up. So this is now passed on. Jill's been passed to the asthma nurse. He immediately receives a notification on his mobile to say there's a life-threatening case that he needs to look at. He then logs in. And Hugh is the manager, so Hugh is able to see the overall team performance. In this case, he's looking at the asthma pathway. He can see the open tasks that have been completed today, and how long it's taking to complete those tasks. Also, on the right-hand side, he can see how many tasks each of the staff at the roster have completed today, and see those that are overdue. So there's a number here that are overdue, and Hugh has the privileges to be able to reassign these to another team member. Obviously helpful when team members are off, or if there's any issues around significant backlog, these can be addressed using this. So looking at the pathway overall, you can see the average time that it's taken to complete. You can see each of the steps that are being taken and how long on average these are taking. So obviously this allows you to see any bottlenecks. If something's taking a lot of time, you might be able to free some time up. And you can see all of the patients that are within this pathway and how long they've been in it for. Looking at this from a diagrammatical way as well, you can see that there are a number of overdue tasks, and you can see where potential bottlenecks might be. So he has complete visibility of the overall care of the patients that are coming into the hospital. This full visibility will drive efficiencies across patient pathways and deliver better care. Thank you for watching.